I want to welcome everyone to our second parent workshop. I'm very excited for today. I want to let everybody know that before we get started, that everyone is muted, and no one's faces will be shown except for myself and our PowerPoint today. Um, just a reminder that please save all of your questions for the Q&A at the end of the workshop. If you do have a question, feel free to type it in the Q&A. Just know that I will be answering all the questions till the end to make sure that we get through the workshop. Alrighty? All right, so let's get started. Definitely a little intro about Evolve treatment and who we treat. We are a treatment center, and we treat adolescents 12 to 17 years old, teenagers that are struggling with mental health, substance use, or any behavioral issues. Um, our admissions team does a really good job of meeting with families and determining what level of care is the most appropriate for your teen. We have three different types of programs. The first one here on our list is a residential treatment center, which is 24/7 supervision, deemed at RTC. We next have PHP, partial hospitalization, which is kind of like an all day treatment, Monday through Friday, except they get to go home every night as opposed to our residential treatment where they are actually living here um, at our locations. And then the intensive outpatient program is a little shorter term of a program. It's about 3 days a week, and they go for half a days. So again, our admissions team, once you meet with them, is they can determine what's most appropriate for your teen. If you look at the picture to the left, that's me in my tree house, and that is actually located in one of our residential treatments in Tarzana. I do love this office. All right, so some of our therapeutic approaches include dialectical behavioral therapy, DBT, which is actually the main therapeutic approach in the house that I'm currently at, Evolve Van Alden, and we are fully DBT comprehensive. Some of our other approaches include CBT. We do offer some group therapies, including seeking safety, relapse prevention, anger management, as well as some family therapy and individual therapy. We also provide the more experiential therapy, which include equine therapy or surf therapy. And right now, unfortunately, we haven't been able to get our clients out there due to the pandemic, but we are working on getting them back to the more outdoor activities. Let's see. All right, so a little recap on our residential model. It is a 24-hour support and supervision, which goes for about 30 to 60 days. It is a 6 beds, meaning about 6 clients, 6 teens. Most of the houses, I believe all houses are co-ed, boys and girls. However, the residential treatment that I'm currently at, the DBT house, we are all females. In a residential treatment, typically you will see that our clients have three individual sessions per week, including family therapy. And family therapy would include one parent call without the teen, and then also one family session with the teen involved. We also provide psychiatric consultation 1 time a week, meaning our teens are meeting with a psychiatrist in order to deem the proper medication and make sure that they're getting evaluated and getting the medical assistance that they do need. We also provide group therapy and psychoeducation several times per day. We do have the ability to offer one-to-one patient monitoring if needed, which means that if one of our clients are deemed to be at higher risk at the moment, as in perhaps higher suicide risk or maybe danger to self or others, we will provide that extra supervision, meaning that a staff member will be closely watching them and being really close in proximity. until we deem that it is safe for them to be without the one-to-one. We also provide an on-site nurse that is actually very, very helpful. That gets a lot of the medication orders completed and provides transportation to our clients in order to get levels of, depending if it's for their medication, follow up, lab work, vitals, and has been very helpful, especially for monitoring client medication daily. All right, so that was a little bit about Evolve and a closer look at our residential treatment. So now back to the webinar and what we will be talking about today. My name is Carolina Dozal. I'm an MS PPS licensed professional clinical counselor. Yes, that is me to the left. It's actually right over there. It's in that beautiful tree house that I do love. Today's topic for today is going to be managing high-risk behaviors in teens. And I definitely am passionate about this topic because I do love working with our higher risk teens. All right, so let's get started. All right, so some of our high risk behaviors to watch out for in our adolescence include a few of these, beginning with the use of illegal substances, alcohol, and tobacco smoking. Most of our teenagers engaging in some of these behaviors, it might be really hard to identify in the moment, which is why it's really important to have a close watch for these. And this can look like, maybe your teen is staying out late. Maybe they smell of increased alcohol or marijuana. Or maybe your teen is actually starting to deal drugs or fitting into the wrong crowd where their friends are actually dealing drugs. The most commonly abused drug by our teens currently is alcohol and marijuana, and the misuse of prescription medications that can actually be found in some of the households, which include Oxycontin, maybe Ritalin, Adderall, or Xanax. And if you do happen to find any unusual items, some of these unusual items to look out for include drug paraphernalia, like needles, maybe pipes, rolling papers, or small plastic little bags. Maybe it's the use of eye drops. These can be used to mask bloodshot eyes or dilated pupils. And if you ever notice that there's any missing prescription drugs or alcohol or empty alcohol bottles, that can also be an indicator that your teen is engaging in some illegal substance use. Another one of our common high-risk behaviors that we do see and something to watch out for is the unprotected sexual activity. So most of our teens engaging in sexual activity aren't actually using consistent birth control. They might not know how to get it, or they might just not care and forget, or maybe it doesn't even cross their mind. They're also not using protection, and if they aren't using it consistently, which both increases the risk of unplanned pregnancy or even a sexually transmitted disease. So definitely something to look out for. Our next one includes sexting and other risky use of social media. And this can include behaviors such as sending or receiving nudes. Maybe it's posting nudes. Maybe it's posting nudes on social media. And for teenagers, sexting can often be a fun and consensual activity for them. It can be, a way to almost connect with their friends and see it as a way to build the relationship. If I send this picture, it must mean that we're really close. It means that we have a different relationship than anybody else. And for some, it can be a way to get validation and increase self-confidence, because if they're sending these pictures, they're sending them for a reason. And it is likely that on the other end, they might be getting validation through pictures of their body. So again, something to watch out for. Next, we have sneaking out. So yeah, sneaking out can be a difficult one, and something to watch out for when if this has happened or you suspect that this is happening with your teen. It can look like when it can look similar to maybe a client who just doesn't care about a curfew. The curfew to the teen that just doesn't matter. They clearly, from your perspective, feels like they just don't care about the rules or the consequences or the boundaries. For whatever reason, the teen feels like sneaking out of the house is okay. Um, and sometimes can look like, they're invincible, which this can lead to maybe other high risk behaviors, because if your teen is sneaking out, they're most likely sneaking out to engage in some of these other behaviors, like the risky sex, maybe the illegal use of substances. Um, so, again, if your teen is sneaking out, it can also be an indicator that they're engaging in some other high risk behavior. Some others include illegal activities like trespassing, shoplifting, um, graffiti, maybe damaging property, maybe sneaking into um, areas where they would be trespassing, like school property, and destroying school property. Um, all of these things that could lead to, illegal action. Something else to watch out for is truancy, is skipping school, skipping classes, avoiding schoolwork. Your teen may leave and come home at unusual times. Maybe they do go to school for some of the time, but miss specific classes, or they leave early. Right. So how do we respond to these high risk behaviors? Because that can be really tricky. Um, how would we respond to alcohol and other drugs? It can be really, really scary for any parent or any caregiver to be in this position of how do I respond to this? Um, and it's really important to, again, ask for help. And I imagine that's why a lot of you are here today, is because we need that extra help. um, so, how do we manage something like alcohol and other drugs? Um, and I guess the first step you would want to do is, if you do find anything concerning in your teen's possession, is to talk to your teen. You know, be open, um, and be willing to have an open mind. Um, keep the communication positive, because the calmer you are, the more positive and more likely you are to get some information from your teen. Maybe it's about what they're doing, who they're hanging out with, where they're getting their drugs from, and avoiding blaming or criticizing or any lecturing, because it's most likely not going to go in your favor, and it will often lead to the teen shutting down, and most likely might even lead to an argument. And I know that when discussing these difficult topics, it can be really hard to stay away from the lecturing and the criticizing, because in our minds we know that these things are dangerous, but for your teen is they might not be looking at it that way. They might be looking at it, it's fun, everyone does it, all my friends does it, I can't be the only one that does not do it. Another one of our behaviors is, and how to respond to it, is our unprotected sexual activity. It's really important that you have that conversation with your teen. Is talk to your teen about the safe sex practices. Maybe you've thought, like, I've already done this, and I definitely want to encourage you to have that talk again. Not so much again as a lecture, but more so as an equal, and discussing the risk factors like sexually transmitted diseases or infections, having unplanned pregnancies, and the dangers of the inconsistent birth control or protection. Most teenagers engaging in the sexual activity aren't consistent, again, with the birth control. And it could lead to, the unplanned pregnancy, or the sexually transmitted diseases. Similar to the sexting risks is explain, have those talks with your teen. Explain the risks to your teen. And how would you do that? Because sometimes that might be a little bit awkward, right? It can be as simple as explaining that sexting or sending news has risks. It can lead to, the risks of images being leaked and shared without your consent, whether it's posted on social media or whether it's getting out to the public, to somebody you know. It's also important to help your teen understand the legal consequences, because if it is reported, your teen could be charged with distribution or possession of child pornography, and then kind of have a record. This could happen even if the sexting was consensual. It's also important to talk to your teen that it's important to say no to sending or receiving nudes, because a lot of the time, not always, but sometimes they may be pressured. Or they might say, almost as a threat, and letting your teen know that, if they ever feel uncomfortable or they feel like they are being pressured, it is okay to say no. And if the relationship is threatened, this might not be a very effective relationship if we feel like our relationship will be threatened if I don't send these pictures. How to respond to our teen skipping school, right? We definitely want to try to help our teen go back to school. And if you know that your teen is missing school, talking to your teen is the first step, right? This can help you work out ways to help him get back in school. And you might want to try following or exploring with them why aren't they going to school? Because if they aren't going to school, there might be a good reason. Maybe it could be increased bullying. Maybe they feel uncomfortable around a teacher or a peer. Maybe they feel hopeless about their grades or understanding the material. Could be many, many reasons. And this can be a good way to address their fears, address their concerns, and talk with the school staff and getting your teen on a plan to get them back in school. How to respond if your teen is sneaking out. Have that discussion again. Some parents find that this can be the most challenging one because sometimes a teen just doesn't care, right? They don't care. The rules just are, oh, all right, and what? But teens have curfews for a reason. And there is a curfew for a reason. Some things that have been helpful is, reviewing, possibly having a household contract, a home contract, a behavioral contract of some sort, where you are very, very clear about the rules and expectations of the house. You're very clear about what the curfew is and very clear about what the consequences are if the sneaking out does happen or if you are late and miss curfew. One of the reasons why teenagers consistently break the rules is because parents fail to enforce consequences or rule breaking. And if your teen is constantly sneaking out of the house, it is time to start enforcing some of these rules without hesitation. Because what happens is if we aren't consistent and we kind of like enforce the rules one week and don't enforce it the next, our teen's going to know that and they're going to push that limit. So again, is make sure to be consistent with those consequences. And depending on what rule they break, there could be levels of consequences. So let's say they do sneak out, the level of consequence for that behavior could be reporting a runaway to the police or reporting a teen out after curfew. And again, is enforcing the limit and the rules of the consequences. And calling the police if needed after curfew. All right, your teen will most likely not be happy with you. And they might also not engage in the behavior again. All right, so handling the difficult parenting moments. This one, yeah, this is hard. And in DBT, which is the DBT that I um, feel very passionate about, and when I am teaching my teens and my parents, is um, dialectics, is walking that middle path. And dialectical thinking refers to the ability to hold two truths that seem opposite and accept that there is more than one way to see a situation. And when we are handling difficult parenting moments, it can be really helpful to walk that middle path, to have that balance of acceptance and change. And one way we can learn how to handle these difficult parenting moments is through the metaphor of walking the middle path, a belief that we do have in dialectical behavioral therapy. Um, it also Dialectics also considers that everyone has different opinions and different points of views. And thinking about things dialectically can help us move towards more of that middle path, and kind of steer away from the all or nothing thinking. Um, right? It doesn't have to be all one way, um, or all another way. There can be that middle path. There is truth to both your side and your teen's side. Um, Also, avoiding the words like never or always is being descriptive. It's important to stay away from those words specifically because it is a little bit of extreme thinking. It is the either or the black and white. Um, so more so of an example of this, um, it would look like, excuse me, it would look like if you are feeling frustrated with your teen, um, and it comes out to is like we're always fighting, you're always disrespectful, you never listen to me. We want to stay away from making those comments, um, because it is extreme, and there could be more effective ways to say that, like, um, you're a teenager and you need to be independent, and at the same time not having all of the freedom. Or sometimes you follow the rules and sometimes you break the rules. Sometimes you do your chores and sometimes you forget. We want to check our assumptions and do not expect that the other person can read your mind. Um, we can't assume that we know what is happening to our teen and what's going on in their head, just as we cannot expect that they know exactly what we're feeling and thinking. When I say we, I say parent as an adult. um, we can always ask clarifying questions, um, effectively communicate. Is what I'm trying to say is that I feel really frustrated. I feel like I'm trying so hard to keep you safe, um, and get you on the right path. And it really hurts. I feel super disrespected when we're consistently breaking the rules. All right, so addressing some of these problems, kind of like I was mentioning a little bit earlier, is we want to collaborate and we want to be consistent. Um, Parent inconsistencies can fuel severe family conflicts. For example, if we're not consistent, that can be extremely frustrating. Um, if they break a rule, and maybe the rule is they don't get to go out the next weekend with their friend, because they got caught sneaking out and smoking weed. All right, well, the rule is next weekend you're not allowed to go out because you broke the rule. Next weekend rolls around and your teen is like, come on, mom, come on. It's my best friend's birthday. I can't miss it. I promise next weekend I'll stay home for the next 2 weekends. I can't miss my best friend's birthday, please. And then you say, okay. Right? So that's kind of the inconsistencies that can fuel those family conflicts. Yes, they might be very, very angry, and they're going to know that if they beg and plead, that they might be able to get their way. And next time when you say no, they're going to be like, well, no, my parent let me go this time. Or the last time, they might let me go this time. Involve the adolescent in identifying what needs to be done. Sometimes that can be really helpful. Sitting down and having that conversation with your teen and saying, hey guys, I'm really burnt out with this. Do you think it's fair that, you are sneaking out and not coming home till 3 or 4 in the morning? Or, I found some concerning things in your room, maybe like an ashtray, or I saw some really concerning text messages on your phone. And having that conversation and saying, what do you think an appropriate consequence would be? Because I don't want this to keep happening, and I don't like arguing with you. So, and I want to know how you feel about this. Like every time that, we do have this discussion, what do you think would be an appropriate consequence? And typically when teens are more calm is they are more reasonable and can come up with a consequence. We also want to ask our teens if they can do what's needed. Are we asking too much of them? And if they need help in order to do what's needed. Sometimes it might be really, really challenging. They might need that extra support and they don't know how to ask for help. All right, is developing those strategies that everyone can stick to. Right, is not making unreasonable expectations for yourself or even for your teen. It's good to know and not keep secrets about anything that's going on, and talking about it openly with your family member. And make sure to keep your team informed, whether that's the therapist, the psychiatrist, or any other professional that you are working with. It's important that everybody knows and everyone's on the same page. For example, is wanting to protect maybe the other siblings in the home. If things are happening at home, whether that's high risk behaviors and arguments, they most likely know, maybe not the whole story. And that also might be fueling a lot of anxiety for them about not having all of the answers and just making assumptions in their minds. And eventually they end up finding out. So keeping that in mind it is important to be as open as possible and model the effective behavior for your teens. And talking about your values, what you value, being a parent. Do I value open and honest communication? Do I value respect, loyalty, trust? And if we're not modeling our own values, our teens are most likely not going to want to follow in line with our values either. They're going to be like, well, if my parent does it, I'm going to do it too. And they don't care. Why should I? So helping your teen also handle the peer influences kind of goes back to maybe your teen doesn't know how to say no. Maybe they might even feel uncomfortable or peer pressured in those high risk situations, and they don't know how to get out. And they feel like they have to go along with it in order to keep their friendships, which is why it's really important to have all of these conversations with them and letting your teen know that it's okay to ask for help, and letting them know that they can go to you anytime. And that can look like, let's say they go out with some friends and their friends are engaging in some illegal activity and they really feel uncomfortable. Maybe that means having a code word, where you guys know that means, hey, I need to get picked up right now. They might feel embarrassed to call their parents and ask them to pick them up. So maybe the code word is red. They text you red. And okay, I'm going to come get you. And your teen communicates to their friends, hey guys, my parents said they have to pick me up now. All right, so the middle path and dialectical dilemmas. So I know we previously touched on walking that middle path, and it's important to do this with our teens because sometimes they're faced with some of the most common and challenging dialectical dilemmas during adolescence. For example, as parents, you often fall on one end of the spectrum of being too strict or maybe too lenient, too loose. So staying mostly to one side can kind of knock us off balance. And instead, what we want to do is we want to strive for that balance. Notice the little bird mama here on the right. She's pulling her chickies, right? She's trying, she's doing all the work. She's doing everything that she can. And I don't really know if that's the mama chick, could be the papa chick. And in this situation, it really feels like the mama chick is forcing the dependence, right? By really doing everything, doing a lot of the work. And the way we can find that middle path is to communicate clear rules and enforce them consistently, while we allow for negotiation on some of the issues, not all the issues, and also refraining from overusing the consequences, because they might be a little bit discouraged if we're constantly just jumping to consequences always. And that can be, again, really discouraging for our teens. So keeping that balance in that middle path. Okay, so kind of looking at these teeter-totters and thinking about how does this dilemma apply to you? And kind of looking through our different pictures here. You guys take a look and read that for a bit. I wanted to add that taking an extreme position can often be really unhelpful. And it's important to consider where you fall in each dilemma and strive for that balance, and communicate to your teen. If you're more willing and able to shift your position towards the middle path, your teen will also most likely be willing and be able to shift theirs and see things from your point of view and perspective. It's important to recognize and seek help from mental health professionals, whether that's therapists, psychiatrists, psychologists, maybe it's the school mental health team, the counselors, school psychologist, and recognize when you might need to call for help. And identifying when these behaviors do cross the line, and begin to kind of cause major problems in the family, in the teen's school life, at home, or their social life. Okay, so I want to touch on the setting limits piece, because setting limits with our teens can be extremely, extremely difficult, especially when your teen has learned how to push and even reject limits that have been set. And this can be super frustrating. So you definitely want to plan ahead. Think ahead of a plan. What kind of limits do you want to set? Will this be implementing a curfew? Maybe limiting screen time? Maybe it's turning in their cell phones at night. Any limit that you choose to set, think about why you think this limit is important, before you decide to just kind of slap on a consequence. And why is this an important limit to set for you and your family and for the teen? And to be the limit setter is to decide what is healthy, what is safe, and are we willing to enforce this? And your first way of enforcing that is through verbal direction, is communicating that to your teen. And if your teen is having difficulty responding to your direction, one of the things that you can fall back on is having that consequence structure, and to use the punishments and consequences effectively. Um, and also be open to incorporating your teen's ideas. Um, again, communicate those clear rules, those clear expectations. Um, and do not protect your teen from the natural consequences of their actions, and allow them to learn about reality. Um, I think that one can be a really challenging one, um, especially if we are one to really want to protect our teen. Um, if they engage in illegal activity, um, don't protect them from the legal consequences. I kind of want to go back to the punishments and how to use that effectively. Um, that can look like having a list of clear consequences, maybe the ones that you collaborate with your teen, and be specific, for each consequence for behavior. So um, let the punishment fit the crime, basically. So if you're out past curfew 1 hour, your curfew is 1 hour earlier the next time, and apply the consequence immediately, not 2 days later. So why implement the consequence? Lots of times parents might be really, really scared of setting that consequence in fear of how the teen might react. Oh no, that the teen's going to get angry, aggressive. Maybe they might harm me or the rest of the family or themselves. And we also need to maintain our limits. And to consequence when a consequence is due. And consequences can also be a way to kind of increase your self-respect in a way. Let's see. Shaping. So remember that it can be scary, and you want to be cautious about using threats and ultimatums. So don't make a threat if you don't plan on implementing it. Don't tell your teen if they sneak out and you call the cops. Tell them that you're going to call the cops and then don't call the cops, right? They're going to know, yeah, my parents are bluffing, basically. So remember that setting limits is a way to shape your teen's behavior into a positive behavior. You set limits by telling your teen no and explaining why once, right? You tell them that what the consequence is and what will happen if the behavior does continue. So managing those high risk behaviors is pay attention and stay calm. And most importantly is safety comes first. Yes, safety comes first. And knowing that your teen pushes those limits doesn't make the risky behavior any easier to live with. It's sometimes when a crisis comes, it sometimes comes in unexpected times and can be extremely overwhelming for all involved, especially parents and siblings. And when caregivers are thrown off and overwhelmed, it's really easy to react in ways that may actually escalate the crisis. So again, is safety comes first. And, if we are easily overwhelmed, is, remembering that the way I respond could actually escalate the crisis. So avoid getting defensive and avoid making accusations or criticizing, however unfair you feel it is in the moment, and allowing yourself to be hurt, and admit to whatever true is in the criticism. stay focused. Don't ignore any threats or self-destructive behaviors. And at the same time is try to stay calm and not panic. Important to consider pursuing resources through routines health providers or your own search. Again, sometimes we may need to call for extra help, and consequences might not be enough. They might need extra help with a therapist and even providing help for yourself and support by finding your own therapist. And consider emergency services if needed. Call 911 if appropriate. Call the appropriate emergency service. I definitely want to encourage everyone to have telephone numbers ready in case an emergency service is needed. Because when we are in a crisis, we're not going to remember where we put that phone number, right? Have it easily accessible. And in a crisis, again, it might be difficult to find those numbers. All right. So now I'm going to share a little bit of my world with you. This is one of our DBT skills, one of our crisis survival skills, improve the moment. It is a distress tolerance skill. And I want to walk through the skill with you because just like your teens are struggling, it can be extremely difficult for the parents and caregivers as well. And knowing your teen is engaging in these risky behaviors can be extremely distressing. So how do we tolerate the distress? Is by one of these skills, improve the moment. It can be a way to make a crisis bearable. And if you look over to your right, Evolve actually has a free virtual parent support group where you can register online at the following link. We have the weekly virtual parent support groups, and now most recently we are creating these parent webinars that are happening once every month. Yes, so back to making the crisis bearable. First one I want to introduce you is improve the moment. So what that would look like is first with imagery. What you want to do is you want to imagine a safe place. Want to imagine a safe place where harm is nowhere near. And it's a place where it has everything that you need. And you want to picture yourself there. You want to picture yourself away from the chaos, away from the crisis, away from the distress. Another option is also imagining yourself coping effectively and successfully in the difficult situation that you're facing. You can also imagine yourself actually seeing the painful emotions drift out of you or flowing out of you. You can even make an enjoyable and a relaxing world of your own. For me personally, it's imagining nature, listening to the birds, listening to the wind and the trees and the leaves, and envisioning, these beautiful mountains, beautiful sunset. And that can instantly bring me a lot of calmness. Our next one is meaning. Sometimes life deals you painful emotions and situations that are out of control, that are out of your control and not your fault. And sometimes we don't even look for it. And unfortunately, the pain is so difficult and it is part of life. Sometimes we can find meaning in the pain. We can find meaning in impossible or hopeless situations. We want to look for ways to focus on the things that are important to you. Maybe your values. Your values don't change just because of the circumstances that you're in. Try to reconnect with them in those moments. Often your values can be a guide in ways to, bring you back. Yes, this moment is extremely painful and I'm getting help, and knowing that that moment won't last forever. Another part of our improved skill is prayer. And prayer can mean different things to everybody. It doesn't necessarily mean religion or believing in God. It could mean maybe believing in a higher power. Maybe it could mean praying for strength to get through the difficult moment. Um, Again, this skill doesn't necessarily have to involve praying. However, it could also mean turning to things like a higher power. Maybe it's practicing yoga or meditation. Um, Maybe it's connecting to your inner wise mind and asking that inner wise mind of yours, please help me get through this right now because I can't do this alone. Some situations call for an approach that's bigger, and prayer can be a way to acknowledge our connection to something bigger than ourselves. Another one is relaxation. There are a lot of things that you can do to bring some relaxation to the situation. And I know that can be extremely wild to think about in a crisis is to relax. Like, yeah, how am I supposed to do that? And it's important to try to disconnect from the situation before we make it worse. And that can look like maybe cleaning the house. That can be, believe it or not, relaxing for some people. Maybe it's taking a warm bath or shower, warm or cold, depending how you like. Maybe it's going for a run or practicing yoga. Maybe for others, it's getting a massage. And I know that's really difficult right now. Maybe it's going for a walk. Maybe it's doing your deep breathing. You're likely more able to resist acting on your intense emotions or behaviors if you are feeling a little bit more relaxed, and you're most likely going to be able to handle the situation just a little bit better. Relaxation can mean different for everyone. For me, it's going to the gym. I know that when I'm at the gym, I feel my most relaxed. It's my safe place in a way where I can just focus on that and nothing else matters. Another important part of improve the moment is one thing in the moment. And what that means is being mindful on one thing and bring focus to whatever you're doing in that moment. Most of the time we suffer not only because of our painful situations, but because of our thoughts. It can mean bringing up things about the past or the future, or we start catastrophizing things about that situation. And that's not really helpful, right? It's not going to do us any good. However, what we can do is we can focus on what is happening in that moment and how are we going to get through this. What you want to do is you want to notice your mind wandering and catching yourself and catching those thoughts about the future or the past and bringing yourself back. And when that happens, be aware of your body movements and sensations. Be aware of what you're doing in that moment, whether it's just cleaning, is just focusing on cleaning. Whether it's walking, just focusing on walking. Or eating, just focusing on eating. Or driving, listening to music, just focusing on that one thing. The next part of improve is vacation from worry thoughts. We all need a break, right? Especially when intense emotions are high and knowing our teen is engaging in risky behaviors. And this skill you can do is taking a break for yourself, giving yourself a vacation. Maybe that means turning off your cell phone for an hour, right? This doesn't mean taking a literal vacation, but maybe a brief one for just a few hours. And again, it can involve maybe watching a TV show, putting down work for an hour, reading a book. This This form, again, can mean different things for everyone. It's your vacation. And last but not least, my favorite part of the skill is the encouragement piece. Um, Sometimes we need to be our own cheerleader. In fact, this can be really, really hard to do for some people because we tend to be self critical. We tend to have a lot of self judgments about ourselves, about our parenting, um, what we could have done better, what we shouldn't have done. And again, that's not going to be very helpful for us in a crisis. Um, and what we could, on the other hand, think about what would be effective to hear right now? What do I need? And tell yourself that you're doing your best. I can get through this. This is hard and it's only temporary. You can get through this. You've gotten through worse. And talking to yourself in a really kind way. I know for sure that after this webinar, I'm going to pat myself on the back and say, it's okay, little C. You had some rough patches, you stuttered a few times, but you got through it, and it was your first one. Yes, so encouragement is something that we all need. All right, so the think skill. This is another skill that I teach my parents and the teens that I work with, and I definitely try to really, really implement this in my family work. And I have my teens use this skill with their parents, and I have parents use this skill with their teens. And this is a skill that we use when you want to make peace, reduce conflict, and reduce anger. And think about it differently. And oftentimes, when we interact with others, when we disagree with other people or someone else, we may approach the situation not the most effectively, and we kind of already have a negative mindset going into it. Our brains kind of naturally just interpret the other person's wrong actions or doings. We already assume that it's negative and that there's a threat. And sometimes, as a result of that, we jump to conclusions. And even if it's clear that, there isn't a threat, it's a lot harder to control our actions when we're angry and we're in conflict. So having this think skill in our back pocket could be really helpful, especially if relationships are important to you and your teen, and you are trying to build a better relationship and communication with your teen. So what that would look like is another acronym is starting with the T of think, is think about the situation from the other person's perspective. How might he or she, or the other person, be interpreting your words or your actions? Put yourself in the other person's shoes. So one way to do that is putting yourself in your teen's shoes. What might they be thinking about the situation right now? Why are they engaging in these behaviors? Are they trying to fit in? Are they trying to build connection? Maybe it's really fun. Maybe, that's maybe it's remembering when we were younger. It's why would my teen be engaging in these behaviors? Or thinking about the fact that maybe we think our teen doesn't care about the rules. They don't care. Maybe they do. And interpreting it a little bit differently. Next is having empathy. What might the other person be feeling or thinking? And it's important to consider how the other person is feeling. For them, relationships are important. Their friendships are extremely important. So having empathy in that way of, maybe once we set the limits and the rules, they instantly may feel like their world is crashing. Like they might feel like we're taking everything that's important away from them, even though that's not the reality. But for them, they might feel like their world is crashing and ending, and they might feel really alone, really sad, and feel like it is unfair. And remembering how hard it is to be a teen and how important our friendships are to us and how much we actually do care how other people think and how stressful that can be. And thinking about all the things that they are willing to do to have friendships, whether it's sneaking out, whether it's doing illegal activity, whether it's having unprotected sex. Next, what we want to do is we want to use interpretations. And what we can do is we can identify more than one interpretation or an alternative explanation for the person's behavior. You want to make sure to consider at least one positive or good interpretation of the situation. Because, of course, if we interpret a negative one, it's just going to fuel our anger even more, and it's not going to help us reduce conflict or peace. So maybe interpreting, you know, why are they doing these things? Maybe for them it is really fun. Maybe it is a way to have friends. Or maybe not going to school. Yeah, school's hard. It's challenging. I wouldn't want to sit on Zoom all day long from 8 in the morning till 3 p.m. That's exhausting. And I also have my teens use this with their parents. Oftentimes when they do set limits and rules, teens may take it to the extreme. They hate me. They don't want me to have any friends. They want to ruin my life. All right. How interpret maybe a positive way, a positive thought or interpretation of why your parents might be setting these limits. And it looks like, well, maybe they're trying to keep me safe because they care. Yeah, it's a likely interpretation. Notice. Notice how the other person has been trying to improve the situation, use their own skills, or show that they do care. Or notice how they may be struggling with stressors or problems of their own. This can affect how the person is acting. Because oftentimes when we're angry with someone, we're disappointed, we're hurt. Again, it's a lot easier to just focus on all the wrong things that they're doing and forget to notice the things that they have done right. Maybe your teen picked up the dishes. Maybe they cleaned up after themselves. Maybe they have been trying to follow the rules for a little bit and they do slip, but we forget to praise them and again just jump straight to attack mode. But we want to notice those little efforts that they are making. Maybe they did go to school that day. Maybe they've been clean from drugs for about a week and they haven't been sneaking out. Noticing those little kernels of truth. Same with my teens. Notice how parents have been trying. I think for them, one of the biggest things that they notice is when the parents start using the skills and talking in DBT language. They really notice when parents make that effort to try to talk differently and validate. And last is use kindness. Is remember a kind and gentle approach when interacting with the other person. Treat them the way that you want to be treated. I don't know about you guys, but for me, if someone's kind and approaches a situation gently, I am a lot more open and willing to have a conversation or to even understand versus someone who's kind of harsh and attacking. I don't really want to have anything to do with that conversation. So remembering to be kind and gentle when going into it. And that can be really hard to do, especially if someone has been disrespectful to us. Okay, so that was the end of our slides. I do want to leave this time for some Q&A. And I definitely want to say thank you all for coming and for taking the time to join the webinar. I hope it was informative. And again, please join us for our next community workshop, which is on March 31st. And the topic will be how to get your teen to talk to you. And you can register right down there on that link right here. Yes. So thank you again, and I will see you guys next time. Thank you.